to the Munson Healthcare Virtual Press Conference. My name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Next slide, please. So Munson Healthcare has been hosting these virtual press conferences and community press updates to keep you informed of the latest COVID-19 information, our stats, our hospitalization numbers, and also answering your questions that we receive through social media and the media. So hopefully these are valuable resources for you each week as we invite different guests to join us. Other ways that you can stay connected with Munson Healthcare include signing up for our e-newsletter that is distributed about every 2 weeks. Contains a lot of great information, including updates on Munson Healthcare visitor policies and other service updates that may fluctuate during the pandemic. Other ways to stay connected are to follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. And of course, as always, please visit our website, munsonhealthcare.org. And I just want to remind everyone that that has a very robust FAQ section and resource list on there for all things vaccine related in Northern Michigan. So today is Tuesday, May 4th. May the 4th be with you all. I'm excited to have some of our regular speakers from local health officials and experts joining us again today. You're going to be hearing from Dr. Christine Nefsey, our Chief Medical Officer of Munson Healthcare. You'll also hear from Wendy Hirschenberger from the Grand Traverse County Health Department, Dr. Morse from District Health Department number 10, and Heidi Britton from Northwest Michigan Health Services. Next slide, please. So we always like to kick things off with welcoming Dr. Nefsey for a general update on our numbers and hospitalization rates and anything new with Munson Healthcare. Welcome, Dr. Nefsey.
Thank you, Diane, and welcome everybody to the press conference. So here are our numbers. We are doing much better than we had been in the past few weeks. So you can see there our cumulative cases, and then at the very bottom box where we are regionally. The important numbers that we look at are the percent positivity rate and our cases per 100,000. You can see here on a 14-day average, we're at 11.9%. We have not been that low since the end of March. So we're happy to be trending in that right direction, and we are at 469 cases per 100,000. Next slide. We still are seeing a significant number of people in the hospital. We currently have 51 COVID positive inpatients across the healthcare system. So still busy, but again, declining numbers that correlate relatively well with our percent positivity rate. So good news there as well. There's the graphic presentation where you can see that most recent surge, the highest we had seen, how long it lasted, and now we're seeing a nice downward trend. Next slide. Again, we continue to see good protection in our older population with the vaccination. So certainly as our older folks have been immunized at a very high rate, we've seen hospitalizations among that population decline significantly, while an increase in the number of hospitalizations for our younger community members. Next slide. We continue with our vaccine efforts, and again, working closely with our health departments in our own mass vaccination clinics and with our primary care providers. We have either given or distributed over 76,000 doses of vaccine. Next slide. People probably saw this week the release of the My Vac to Normal Challenge, where the Michigan Department of Health and Human Services is correlating the reopening of our economy and some of those rules with the percent of folks who have received their first dose of vaccine. We are doing fairly well in Northern Michigan. I won't read this slide to you, but it's still unclear whether things will be opened regionally or by the state. But we aren't quite there yet in Northern Michigan, but we are well on our way if we continue to have the success with our vaccination efforts that we have in the past couple of months. Next slide. And again, we know there are a lot of questions people have about the vaccines and whether it's right for them. So I strongly encourage everyone to talk to your primary care doctor, even if you don't think it's right for you. Be knowledgeable about the risks for you and for the other members around your community. Talk to your primary care doctor who knows you and your health the best. And if you don't have a primary care physician and still have questions, our Munson Healthcare Ask a Nurse line is available to you. Next slide.
Thanks, Dr. Nefsi. Before we move on to the next segment, I do have just a couple of questions for you. Last week we talked a lot about the impact that the COVID-19 pandemic is now having on younger populations, and that are we still seeing the younger people being hospitalized right now, or has anything changed since last week?
No, we still continue to see a younger population be hospitalized, and especially in the pediatrics range. I think some people may think that multi-inflammatory system is the only thing that impacts kids when they get COVID. That's not true. That is one complication that pediatric patients can get from COVID, but they are still getting hospitalized just like older adults do with pneumonia and other complications, respiratory distress and respiratory failure from COVID-19. So it's a both and we unfortunately are still seeing a fair amount of pediatric population hospitalizations for COVID-19. Even in our own hospitals, as we look, we are definitely seeing a trend toward younger folks coming into the hospital and being hospitalized rather than where we were in the past surges where it was, primarily our older population.
Thanks. Yeah, I know I heard the term COVID pneumonia in children mentioned late last week. So thanks for that update. So in relation to that then, I know there has been some news about a possible vaccination for a younger population. Can you please give us an update on that?
Yeah, so Pfizer did apply for emergency use authorization to bring the Pfizer vaccine out to as young as 12 years old. The studies that they've done are very, very promising. Young people have better immune systems than some of the older folks we do. That's why we immunize kids when they're little. But yeah, some very promising results from the preliminary studies that have been done on Pfizer in preventing COVID-19 in kids and in safety. So we are expecting to hear whether that emergency use authorization has been approved either this week or next week. And we stand by ready with Pfizer to start immunizing those kids in our primary care pediatrics clinics and in the health departments.
So is it exactly the same vaccination that they're currently giving to the adults that would be given to the children? Got it. Okay. It's just that they did the clinical trials on
Correct.
The younger generation. Okay, thank you for that clarification. So I do know that, we do get a lot of questions from parents. So I imagine that with that happening, we will be getting many more questions, or parents may have a lot of questions. We do encourage you to, always go to your primary care physician or your children's pediatrician first. But if you have additional questions or can't reach anyone, please use our Munson Healthcare Ask a Nurse hotline at 231-935-0951. So thanks, Dr. Nefsi. We will have you back during the Q&A session after our other speakers. And as a reminder, I do encourage you, as you're thinking about your questions, you can submit them through this Zoom call if you're a reporter and joining us directly on Zoom, or through Facebook, and those questions will filter to me and we'll get through as many as we can at the end of today's press conference. All right, moving on. Next, I'd like to welcome back Wendy Hirschenberger, who's the health officer with the Grand Traverse County Health Department. Wendy, it's always great to see you. Looking forward to your update.
Thank you. Good morning. So for Grand Traverse County, I would say that Dr. Nefsi summarized our numbers quite well as well. We're definitely seeing a decline in the percent positivity, as well as the number of average 7-day number of cases. And I will also reiterate that we have seen a higher percentage of our cases in that 0 to 30 population. And we have recently had some deaths of people who are quite young. So I think a female in her 20s, a female in her 40s, a male in his 50s, and so that's a an alarming trend for us to see that. So right now we're very focused on the vaccinations. A year ago, I didn't think I'd be saying this, but this is a vaccine preventable disease now. And so taking the approach that we have always taken with all vaccine preventable diseases and trying to do our best to get as many people vaccinated, however it is convenient for them. So we are still working through the high schools, vaccinating those who are 16 to 18. Affiliated with the schools. We also have multiple community clinics going on, and also partnering with several businesses, larger industry, places like that where we can bring the vaccine to them, maybe during their work hours. That makes it more convenient, or right after they get off of a shift. We are doing walk-in clinics at the Haggerty Center this week. On the next slide, I'll go through the dates and times, but we are offering both Pfizer and Johnson & Johnson for most of those, so people can choose. And just to note, at the Haggerty Center, there was some construction that was started this week on the Circle Drive. So it blocks the front entrance. So if you go to the Haggerty Center, you can park on either side. You can park all the way closest to the water, and there are signs, and you essentially enter the glassed area, but you enter it from the water side or the bay side. So it's just a little bit of a flip, but there are quite a few signs there that indicate that. We also have a homebound hotline that is now live. It's 231-995-6084. We had been partnering and still are with a lot of agencies who provide services to those who are homebound, who had referred a lot of clients and actually vaccinated them themselves. And so this line is now also for anybody who might know somebody else who's homebound, or maybe somebody who's listening, who can't get out to one of the clinics. So we do encourage them to call that number, and we will arrange to get them vaccinated. So the important thing about vaccine preventable diseases is there's always vulnerable populations that can't get vaccinated. And so that's why it's so important right now that anybody who can get vaccinated does. We're still working towards that 70% minimum threshold for community immunity, but the vulnerable populations as of right now are children under 16. If we get the approval of the Pfizer vaccine down to age 12, then it would be children under 12. Anyone who's been advised against receiving the vaccine for specific medical reasons, and that would be something through a conversation with their doctor. So it is important, because when you get vaccinated, you're protecting yourself, but you're also protecting others in the community, which is why it's so important. And vaccinating yourself does prevent transmission to others. And so some of us have friends or family who have cancer or other immune things that means they can't get vaccinated. And so we do want to do what we can to protect everybody. Next slide, please. All right, so this slide just shows our clinics for this week. We will be sending out now on a weekly basis the information for our clinics, now that we're not predominantly just doing mass vaccination at one location. We're out and about. We will be sending this information out. So today you can walk into the Haggerty Center from 2 to 6, and you can get Johnson & Johnson. So we did partner with some of the building trades trying to promote this to that group, but anybody can come between 2 and 6 today. Tomorrow, between 9 a.m. and 3 p.m., we'll be offering Johnson & Johnson and Pfizer Vaccine. Same on Thursday from 9 to 2. And then on Friday, we are back for a second dose clinic at Fife Lake Township with the Pfizer, but we'll also be offering Johnson & Johnson to anybody who maybe didn't make it to the first dose clinic 3 weeks ago. And we also have several other school clinics that we're doing this week that are closed point of dispensing clinics. Next slide, please. Just to talk a little bit about vaccination progress for Grand Traverse County. Right now we are at actually at 61.8%. I checked just before we came on, so we're eking up a little bit, who have received an initial dose, and we're just under that 50% threshold for completion. So really doing well. a little bit ahead of the state average, which is great to see that higher uptake in Northern Michigan. And then the bottom graph just shows how we're doing by the age groups. So the senior age group, we're doing very, very well, and continuing to try to bump up the rest of the age groups so we get closer to that threshold, like I said, of 70%. And what's important about that community immunity threshold that you hear, the 70%, is that when enough people are in the community are vaccinated, it actually slows the spread of the disease to others. And so that's why it's so important. Next slide, please. And then this slide I just wanted to share. So we've been getting some questions from people about, so once you're fully vaccinated, what does that mean? Well, once you're fully vaccinated, so it's been 2 full weeks since you had your second dose or your first dose, if it was Johnson & Johnson, you're considered to be fully vaccinated. So that means if you are in a household where everyone's fully vaccinated and you are going to another household, say a family members who they're also fully vaccinated, that you do not need to take some of those prevention measures that we had to in the past when vaccine wasn't available. However, if you're with somebody who they're unvaccinated and they're low risk, if they're low risk for severe disease, then no prevention measures are needed. That doesn't mean you can't take them, however. If you are with, if you're fully vaccinated and you're with a mixture of people who are low risk and high risk, if there's one high risk person in the group, then you really do need to take those prevention measures to protect them. And then if you're also with multiple households of others who haven't been vaccinated, then again, you want to take those same prevention measures. So wearing a mask, doing the 6 feet spacing, being outside if you can, washing your hands. So we'll start to see more of these kinds of things that will come out to demonstrate people. So once you're vaccinated, what does that really mean? They are doing studies, and so I just wanted to share this information today.
Thanks, Wendy. And if we could just stay on that slide for just a second, I do just have a couple of questions. So first of all, a comment for you, Wendy. This is a really good graphic representation, because reading through all that information, this really helped me understand it better. And, you know, it was, I have a personal story around this. You know, my mother-in-law's birthday was on Sunday, and my brother-in-law's birthday was on Saturday. And we finally, for the first time as a family in a year and a half, were able to get together and celebrate those birthdays in person, because all of the adults in the group were completely vaccinated. However, we did take extra measures just because, you know, we are multiple households, so we had a barbecue outside. But it was just one of those things that we just celebrated as we were all vaccinated finally. The only downside was we didn't have any children there. The kids are in college. They're still, you know, some of them are still waiting to get vaccinated. So we're looking forward to when we can bring the kids back, and because we did want to try to protect them as well. So thank you very much for that graphic, and we'll also link to this on our website as well. And I do just have to make a comment, Wendy, too, about your vaccination clinic at the Haggerty Center and the back entrance there. I can't imagine a more beautiful location to get your vaccination at. Looking over the water there and getting your vaccination at the same time sounds like a good plan to me.
I agree. When the Lieutenant Governor visited, he commented on the view, and I said, yep, it's the best place to go to get a great view for vaccination clinic. So
yeah, so look into that one, everyone. And then just Wendy, real quick, you mentioned that you were trying to work with businesses to actually, you know, partner with them to get their employees vaccinated and maybe going to their locations. If you're a business owner and you want to take advantage of this, do they just contact you directly through your phone number or your website?
yeah, we've been partnering with our Joint Operations Center group and some of the business leads. So we have multiple conversations going, but yeah, if they want to contact General Health Department, gtchd at gtchd.org, we certainly will get the information. Or
Great.
yeah.
Oh, or I'm sorry, I didn't mean to cut you off.
Or they could call 231-995-6100. and they could leave a message, and then that will get to the appropriate person for planning purposes.
Great. So we'll also add that information to our website in case you didn't catch that just now, and we didn't have a slide for it. But thanks for taking that time, Wendy. All right, Wendy, we'll bring you back for the Q&A session in a little bit here. Again, please submit your questions as you're thinking about them. And next, I'd like to welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Dr. Morse, it's always a pleasure to have you with us. Looking forward to your update.
Thanks. So we are shifting a little bit in strategies as well with our vaccination clinics. We are doing walk-ins on Tuesdays in our offices. And I just found out that starting next Tuesday, our clinics will be open until 6:20, so almost 6:30, to walk-ins and appointments. So trying to help out those that may work until 5 or 6. So just know that our offices are open until after 6 for walk-ins and appointments. We're offering all 3 vaccines. We may not have all 3 at each office, but you can go onto our website to schedule an appointment, or again, you can walk in. We are also, like Wendy was talking about, trying to set up different community clinics and worksite clinics as well. In just a minute, I do have some images of our new mobile unit that we have, and we're happy to partner with any area festivals or events, or after church, or anything really where people might want to have vaccinations offered. So really, same as what Wendy was talking about, if you have any ideas or thoughts or requests for vaccination, we are ready to travel to wherever people are eager to get vaccinated, because we know that those that are able to come to us are pretty much all vaccinated now. So we're happy to start going to where people need to be vaccinated and just can't get to us as easily. We're also seeing our cases and percentiles of positivity going down. Everything's still much higher than it was at the low point in February. So we don't want people to get too excited and start throwing all their preventative measures away yet, but we are seeing some promising trends. Very excited about the increased approval for Pfizer. I'm very excited to get my 2 children vaccinated. So it is a very reassuring feeling, once you have your whole family vaccinated, like Diane was talking about. So we are very excited to have that opening up. And just, the school year's getting close to over, but, it is still important for everyone to get their younger family members vaccinated so that we can look forward to a much more routine school year next year. And, as you do family traveling over the summer, and if you have summer sports, things like that, it's still important to get your kids vaccinated now, even though you may think, well, school's almost over, why bother? I'll do it in August. Still, it's really important to do that now so that we can have, good preparation for that return to normalcy, hopefully in the fall, because it was a challenging school year for all of us. All of our contact information is on the slide here, and I know it'll be up again at the end. But again, if you have any thoughts, requests for a mobile visit from us, if you could go to the next slide, that would be great. We did throw up some images from our new mobile unit. Somehow in this, it looks tiny from the outside, but on the inside, there's actually a full exam table, a nurse's station, some teeny tiny refrigerators and freezers, a tiny little bathroom. So it really is a fully functional mobile unit. The little bar on the left side there is a pull-out awning. There's a lift. Those little windows that are covered on the left side, that's actually a lift for those that may have mobility issues. So this is a fully functional mobile unit that we can use. So again, we are happy to hit the road and go where we're needed. We do have a COVID hotline. It's 231-305-8675. And by email, it's just COVID dhd10.org. So for people with questions, or again, if you're interested in having us come to you, please let us know. I think that's all.
That's great, Dr. Morse. I love the new van. That's so exciting. Please look for that in your communities, or call their office and get one scheduled for your work site. That's so, or church or group, whatever group gathering you're having. That's exciting. Thanks, Dr. Morse. All right. Next, I would like to welcome Heidi Britton, who's the CEO of Northwest Michigan Health Services. Heidi, I hear you have some exciting updates. I know you guys have been really busy working through things, so looking forward to hearing your update. Welcome.
Thank you. Just need to get my video going. I think the host has to do it.
Let's see if we can get that started for you. So I sent you a little, you should have a pop-up message that says
can you do it one more time? Thank you.
Sure can.
Got it.
Okay.
Thanks.
Love Zoom.
Thanks for having me. It's been a while since I've been on this call, but thought that it was a good time to come out and say where we're at. Over the past few weeks, we've spent a lot of time doing some clinics throughout our service region, down in Benzie, down in Manistee, Oceana County, as well as curbside here in Traverse City, Benzonia, and Shelby as well. So we're, like everybody else, also pivoting. We are providing multiple options to be able to get the vaccine. So our goal right now is taking every opportunity we can to get folks vaccinated and not missing an opportunity. So we're providing curbside, we're providing walk-ins, and we're doing pop-up clinics. Like Dr. Morse was talking, we also have the mobile medical clinic that zips around. We were in Olson's parking lot yesterday, and we're able to vaccinate 20 people that were coming to get the groceries. So that's a huge win, and that's what we're here to do, and this is what we're here for, is to make it convenient. We also had both Moderna and Johnson & Johnson on the bus, so people could have a choice of what they would like to have for the day. And of course, if it's the Moderna or Pfizer in the future, then we would help them schedule for the second dose as well. We're working directly again with the farmers to provide vaccines to our seasonal agricultural workers. So we're doing pop-up events at the farms. We will be up on Old Mission Peninsula here in May in the next couple weeks. Contacting both the wineries as well as the farmers to say, hey, if you're up here, go ahead and stop on in and get a vaccine. We're going to keep our website up to date to have a link of the schedule of appointments, very similar to what Grand Traverse County Health Department is doing, so that the public can know where we're at. And sometimes we'll make a last minute decision just to drive over to Tom's and put our truck there, our mobile medical clinic, and it'll be a surprise, right? And lastly, we are no longer doing any community testing. In general, we were for a long time doing community testing with standing orders if you're asymptomatic or symptomatic from your doctor. But at this time, because we've pivoted so much to the vaccine and the importance is to get more people vaccinated, we are doing testing, but it's within our clinic. And so a telehealth visit would occur with our medical providers, and then you can come in and get tested that way. So yeah, that's our update. Again, a whole thing is making sure no missed opportunity to get shots in arms. And thank you for having me.
Thank you, Heidi. Great update. Glad to hear all the great work you're doing. And that's exciting. You'll be going to wineries and all over the place. So I'd like to ask all of our panelists to turn their videos back on. I know, Wendy, you don't have video capabilities, so we will keep you in mind, even though we can't see you. Heidi, I'm going to send you another little update to keep your video back on, as well as Dr. Morse here. So, all right. So the first question is for Dr. Nefsi. In the past press conferences, we've spoken about different variants that we're seeing. Are we still seeing variants in Northern Michigan? And I'll probably ask Dr. Morse and Wendy also to weigh in on this, but from a hospitalization perspective or Munson Healthcare perspective first.
Yes, absolutely. We're seeing the variants And we work with the state health department as well as our local health departments to do surveillance. We hear from them regularly as new variants pop up around Michigan. We don't do testing on all of our patients just because, the logistics of doing that, but absolutely the variants have played a huge role in this most recent surge, and we continue to see them fairly prevalently across our community.
And are they still more contagious and or more how do you say that?
Yeah, there is a lot of thought and good studies that would support that the new variants are more contagious than the original version of the coronavirus that we saw early on.
Okay, great. Thank you for that update. Next question is going to ask Dr. Morse to take this one. Considering the effectiveness of vaccines, some people are chafing at why fully vaccinated people still need to wear a mask, and suggest that undermines the message that the vaccines are so effective. What do you say to people who raise those concerns? And I think we've sort of answered that a little bit about the vulnerable population still out there, but what would you say, Dr. Morse?
So we know that the vaccines do really well at preventing us from getting seriously ill and getting sick. We're pretty sure the vaccine does well at keeping us from getting infected and from transmitting the virus from others without knowing it, but we're not positive of that yet, just because the preliminary studies were really done on people getting sick, so having symptoms. So as we're learning more about whether or not people are getting infected without symptoms and transmitting the virus after vaccination, we still need to be cautious and wear our masks when we're in public after vaccination, just in case we could unknowingly be infected and transmitting the virus. As we get more information and as more and more of us are vaccinated and have that community immunity to rely on and aren't as worried about transmission from those, maybe rare people that might be infected and not know it and transmit it, we do still need to be cautious and use all the tools we have to prevent any kind of transmission in the community.
Great answer. Thank you for clarifying that. Next question I'm going to ask of Wendy, because Wendy, you did mention that this is a vaccine preventable disease now in that category. The question is from one of our reporters: if teens can be vaccinated, do we expect that will get us closer to that 70% community immunity rate, even if the older population declines vaccination at this point?
That's an excellent question. So what I would say is the calculations that you see for percent coverage that are on the state dashboard, or even that I'm talking about in the slides, the denominator actually only includes those age groups that are eligible. So once it becomes eligible to the younger, we will add that population in, for the calculation. So we'll have to see if the younger 12 to 15-year-olds have a higher uptake than 70%, then it could improve the number. If it's lower than that, then might have a little bit of effect. I will say that, just speaking for our county, there's about 4,200 16 to 18-year-olds. So it's not a huge percent of the population, but it definitely contributes. So every little bit helps. And I think it will really help schools and kids and parents to have more of a normal school year next year if we can get as many who are eligible to be vaccinated in that younger age group.
Thank you, Wendy. Next question, I'm going to ask Heidi to address this one, and others may want to weigh in on an answer as well. It's being reported that the FDA is set to authorize the Pfizer vaccine for ages 12 to 15, or possibly as early as next week. What good will that do, and what kind of outreach might be necessary or buy-in? And I know that you're focused on reaching specific populations and doing a lot of community outreach. I'll ask you, Heidi, to weigh in on that first, and then I'll ask the others.
I think that it's important. This age group is important because right now they're high risk for getting it. They are not protected. So we, personally, my husband and I being vaccinated, protect our two children who are in middle school to ensure that they're safe when we travel. And so having them to be able to get vaccinated, having our school children get vaccinated is huge, keeps them in school, keeps them from having to be, if they are exposed, from being quarantined. We know here in Traverse City, this is huge. Right? It's better that they're in school. They don't have to be quarantined if they have been vaccinated. That will just set us up so nicely for the fall, which all of us want our children to have a school year for hopefully for 2021, 2022 school year to be back to less kids being quarantined, more classrooms having more flexibility, and feel like we're moving through this pandemic.
Thank you, Heidi. Next question is for Wendy. The New York Times published a story yesterday citing experts who think the country won't actually ever reach herd immunity. How likely do you think that is to happen in our region? And if we don't make it, what does that mean from a population health perspective for our community?
Well, I would say when I'm looking at our regional numbers for vaccinations, we are doing very well as a region, higher percent coverage overall than the rest of the state. And so there are, I would say, at least 3 or 4 counties in Northwest Michigan that are within 10% or less of that 70% threshold. So I think it's very feasible that we will reach that 70% threshold in quite a few of the counties. Hard to say for some of the others, and maybe Dr. Morse can weigh in because she covers a 10 county area and I only cover 1 county, but I have been watching our region. It is really important that we hit that, just as with other vaccine preventable diseases, that the immunization coverage, whatever rate you're at, and you want it to be at least 70%. I of course would like to see it higher than that. But it creates a safety net. And so there's a lot less chance that you'll see outbreaks or just community-wide outbreaks. You might see targeted ones from people having gatherings from people they know, things like that, but it will reduce some of the need for a lot of the stricter measures that have been in place if we can achieve that community immunity threshold.
Dr. Morse, do you want to weigh in on that as well?
Yeah, I think one thing to clarify is that we don't know what percentile we need to reach. This is a brand new virus and, a new pandemic. It could be 90%, it could be 95%, it could be 60%, which I doubt because we're kind of close to that already. But, we don't know what magic number we're going to need to hit. My suspicion is whatever we don't reach with vaccination, we're going to reach with natural immunity from infection, which may or may not last as long or be as good as vaccination immunity, and comes with all of the laundry list of risks that natural infection come with. So I think one way or another, people will get antibodies. It's just whether you do it without the risk of, illness, hospitalization, death, long COVID syndrome, things like that, or whether you do it with vaccination, which doesn't have those risks and may actually last longer and be more robust. So,
thank you, Dr. Morse. Dr. Nefsi, this next question is for you. Because children a lot of children cannot be vaccinated right now, what advice do you have for parents who are trying to, manage in this world right now where the adults may be vaccinated, the children maybe not? Are there any tips? And I know you're a pediatrician as well, so this is near and dear to your heart. How do we keep our children safe right now?
I think we just follow the mitigation efforts that we've been discussing all along. We know that kids are safe to wear masks, so they should be wearing masks when they're out in public and around other people. We should be limiting their exposure. We've talked a lot about having a pod of people, that are safe and doing the right things, or at least the things that are in line with what you are doing as a family. Certainly as more adults get vaccinated, they can have a broader pod or broader exposure to those vaccinated folks. But, the same mitigation efforts we've been talking about with the distancing, keeping them out of large crowded places, wearing a mask, washing their hands, all those same things. And then we'll just, the more people, that's how herd immunity works. The more people around you that you can get immunized, the less chance the virus has of spreading. So if we can get more people immunized, that's going to protect our children. And let's not forget, there are other vulnerable adults who, for their own health reasons, I have a good friend who has breast cancer. Her chemotherapy makes it such that she can't receive this vaccine. We have an obligation to our children and to people like that to immunize and protect them through our safety because they simply can't get it.
And Dr. Nefsi, I'm going to ask you a question here that keeps coming up on social media, and it just came through again today. It's about Munson Healthcare workers and our vaccination rates. So the question is, a new survey conducted by the National Rural Health Association and Chartis showed only about a third of rural hospital executives said that 70% or more of their staff were vaccinated. What is Munson Healthcare's rate? What is the national rate and Munson's rate? Tell us about barriers to reaching the goal of an overall 70% vaccination rates, and do we track that number? And of course, we've reported it before on these press conferences. Yep,
we're still hovering at about 67.8%. We are hearing a lot from the public that people like the one and done Johnson & Johnson vaccine. So we are starting to offer Johnson & Johnson vaccine clinics to our employees, and we hope that more people will adopt that and our rates will go up. But the reality is that our healthcare workers are an absolute reflection of the community around us. And so our rates are at 67.8. And there's wide variability, though, between who is getting vaccinated. So our frontline employees that have been taking care of these COVID patients have a much higher vaccine rate than some of our other employees that maybe have been more protected from seeing what's going on from a COVID-19 perspective. And our physicians, our rate is in the high 80s. We have some hospitals that 100% of their physicians are immunized. So again, it's the people that are seeing this disease, experiencing it, taking care of these patients and their families, they are vaccinating themselves. But we still have people that have the same concerns and fears, some of them based in reality, some of them not, that the rest of the community is seeing. And so we're going to continue to work with our health departments and our employees to encourage it and to try to bring out good science about the safety and efficacy of these vaccines to everyone, not just our employees, but our whole community.
Thanks, Dr. Nefsi. And I'll just add on to that, when you think about healthcare workers, everyone thinks about those frontline nurses, doctors, things like that. With a health system of our size, there are over 8,000 people that support the work of those frontline workers. So there's many of us like myself who have been working remotely throughout the entire pandemic. I haven't stepped foot in a hospital except for my own personal needs, healthcare needs. And, so in the beginning, when these vaccines were coming out, I was thinking, well, why would I get vaccinated? I'm barricaded in my home. I'm not going out. I'm getting groceries delivered. I don't know if I trust this either. But then when I thought about it and I thought about, wow, I have to take care of some elderly parents and I have family that I want to see and I want to get there, it made me change my mind. But again, there's many of us that are working remotely or have just, again, we're a reflection of the population and we were all a little scared at first. But I think the data that you're referencing and just the fact that now they've been testing it on younger populations and that's just going to continue to expand the knowledge we have around the efficacy and the safety of these. So I appreciate you continuing to share those numbers. The other thing I'll mention too is that throughout the pandemic, Munson Healthcare has had to hire more staff. Our staff are really tired at this point. I was talking to Wendy on this call yesterday, and she said the healthcare and the health departments were the first ones in, and we're going to be the last ones out of this pandemic because we have to be here for everyone in our communities, and we have to be here for the duration. We don't have the option of saying, oh, I can get a little lax, or I don't want to do this anymore. But as we've added more healthcare team members, that rate or that percentage rate is going to fluctuate evaluate because we aren't starting with the same denominator anymore. So just want to make that clear if people are asking. So unfortunately, we are out of time. I appreciate all of our panelists, Dr. Nefsi, Wendy, Dr. Morse, and Heidi. It's always great to hear your updates. I just have one last slide here. I just want to mention that, again, you can connect with us and stay informed via our e-newsletter on social media, munsonhealthcare.org. And then, Dr. Morse and Wendy mentioned that we always have that slide up that shows the resources. And of course, this was the first day that I said, let's not put that slide in there because that information is posted on our website. So I do encourage you to go to our website. All of those contact numbers and websites and emails are listed, we link to them from the munsonhealthcare.org website. And again, our Ask a Nurse hotline is open, 231-935-0951. And we are just here to answer your questions and to help educate you and, point you in the right direction. So encourage you to use that as a resource. And again, we will try to do another one of these updates next week. We'll try to have some of our medical experts back with us, and hope you all have a great day, and we will see you soon. Thanks, everyone.
Thanks, Diane.